Now look at another rare condition, which has to do with high levels of cholesterol in the blood. Okay, and of course, once you say familial, you know that it is family linked. Okay, people can be able to, you know, inherit it along the family line and all of that. Okay, so familial hypercholesterolemia. Okay, so for familial hypercholesterolemia, we said that it's a genetic disorder and it causes lipids to be so high. And this thing is not acquired later on in life, it's from birth. So the person is having lipid issues from birth and you're actually suspecting. And of course, the person might have, inherited it along the line. So I have a lot of symptoms you can watch out for. So there's a risk of premature heart disease and also stroke. The person developing all these heart issues early on in life. So what are the genes that are involved that if there's a mutation, you have these issues? We have the LDLR gene, we have the APOB gene, we have the PCSK9 gene. So it's autosomal dominant. Even if one parent have it, they can be able to pass it to the children. So we have the different types, heterozygous, where there's what? I think there's a switch here. Heterozygous to be two mutated genes, while homozygous should be one mutated genes, right? So there's a switch there. So symptoms. You see that what cholesterol levels should be so high, about 190 millideciliter in milligram deciliter in adults, and about 160 in children. So they also have xanthomas. See all these swellings around the joints, skin patches and all of that. So xanthomas around the tendons, the elbows, the knees, the Achilles tendon. They also have xanthalismas, corneal arcus, issues around the eye, all of that. So risk factors include heart disease. Okay, severe cases can actually cause heart disease in childhood. Complications is atherosclerosis, stroke, and peripheral artery disease. Okay, so that's what we got. So diagnosis, you do all those blood tests, you know, family history, genetic testings, and children at risk should be tested as early as 2 years. So treatment is all those lifestyle changes, hard healthy diet, regular exercise. You already have a risk factor, so don't add things that will actually make it easier for you to have that disease. Don't smoke, you start taking your drugs early, the statins, you know, the SZT, maybe the bile-acid sequestrant, and fibrates and all of that, right? So that you start up quickly. Okay, so this is what we have for familial hypercholesterolemia.